And good evening, and welcome to this episode of the Ask Dr. MJ Facebook Live, Instagram Live, YouTube Live, and live on the Lipo Drops website for the very first time. We have our broadcast this evening. We'd like to thank each and every one of you for tuning in because we know you have options, and we want to get on and off as quickly as possible because I know a lot of the local people want to get to the Atlanta Braves playoff game. So thank you so much. We appreciate you, and we are here now, live in the studios of Atlanta West Primary Care. Dr. MJ Collier here to answer your healthcare questions, the only interactive healthcare forum that allows you to call in and ask your healthcare questions. Okay, now, a couple of announcements. We got several new products that will be coming on board within the next week, and there will be special incentives for those that are watching tonight and those that are in the Lipo family. There's going to be a Lipo Drops sea moss formulation, a Lipo Drops mushroom formulation. Lipo Hers is here. Ladies. The Lipo Hers. We have the Lipo Tea for the men that it changes and enhances and just maximizes your love life. And ladies, we now got the Lipo Hers. It will be available within the next week with special incentives for those that are watching tonight and those that are in the Lipo Facebook family. So let me tell you, this is the time now to join the family. Lipo Cares. Go to the website, lipodrops.com. It will walk you through each and every step that you need to do to participate. And tell all your friends. Don't keep it a secret for yourself. Let everybody know. We got the new Lipo Nights product, which in addition to the Lipo Drops Max, allows you to lose weight and burn fat overnight while you're sleeping. Yes, it allows you to sleep. Now, this is a capsule. It's not the drops like the drops. And I've had people say, well, isn't it the same formulation? No, it's totally, completely different. But it does and enhances your weight loss in a variety of different ways. So the Lipo Nights, the Lipo Hers, ladies, look forward to it. The Lipo Mushroom product and the Lipo Sea Moss. We're going to make sure that your immune system is optimized and your general health. We're going to help your cardiovascular health. We're going to help your mental health. People are always asking about what can I do to enhance my mental acuity? I feel like I might be losing it. Some people even say, I think I'm getting some early dementia. Well, you aren't getting early dementia more than likely. More than likely you're just having some age-related slowing down, so to speak, of the processes. Think of it from this perspective. Your brain is like a computer and it has a certain amount of storage in it. And as over lifetime, every time you do something, a new file is added in. Eventually, you can't add any new files, or you can't add a new file until an old file is discarded. That process may take your brain a second or two. So that means in the meantime, you're still sitting there trying to figure out what's this person's name I'm talking to, or the one that just walked up to me and spoke to me. Where did I park my car? And then all of a sudden, after a second or so, it pops into your mind fresh and clear. You say, oh, okay, I got it now. That is a normal process. Part of that is also a deja vu process, which means you have done these things so many times that your brain, again, it just remembers that you've done it before. And so that can slow down the process in doing so. Okay. All right. Let's get to our countdown right here. Let's see who we got joining us this evening. I'm going to take a sip of water. Let's see who we got tuned in. All right. Audra Shanae from Accra, Ghana. She made it. Audra Shanae, thank you so very much. All the way from the motherland in Africa. She is there on a personal journey, trying to learn a lot of things about Africa and just enjoying herself. She told me she was going to try to tune in, and amazingly enough, the internet is working there. So thank you. You're going to get the award for the furthest call yet. Mimi Witcher calling. Okay. Thank you, Mimi. I think you're in Tampa, but you might be in Atlanta as well. Thank you for tuning in. Kanisha Coates from Nicococas, LA, Louisiana. Thank you so much. We got that. Okay, Sean, Big Time Green, my man. Sean, we got you on the Lipo Tea. We want to make sure that you put the lady in your life on that Lipo She. It's going to be amazing. CL Turner, good afternoon from Baton Rouge, LA. Thank you, Baton Rouge in the house. Deborah Mathis, hello, Deborah. Thank you so much for returning. We're so glad to have you here as well. All right. Riley, hello. Where you calling from, Riley? We so glad to see you. Love those emojis. Love you back. Okay, Harriet Bastian checking in from Florida. Hi, Harriet. How are you? Thank you so much. I was in Miramar, Florida last week speaking. Well received. Really enjoyed that trip. Christina LaJoy Spicer. Hi from Missouri. Missouri, Missouri in the house. Thank you, Christina. Winnie King. Hey, Winnie, how are you? So nice to hear from you from Terrell, Texas. Thank you so much. Ann Wells, good evening, Ann. Thank you so much for joining us this evening. We appreciate your participation as well. Sherry Gamble from Dallas, Texas. Hi, Sherry. You are a returning group member. We're so glad to have you here. Amber Chambers, Seattle, with chronic fibromyalgia diagnosis this month. Okay, we're going to talk about that, Amber. Okay, Ann Wells from Fort Lauderdale. Thank you, Ann. We appreciate you. All right. Jackal from Columbia, South Carolina. Thank you, Jackal. We appreciate you for signing in as well. Andy Barron from Daytona Beach, Florida. Boy, I wish I was in Daytona right now. I'm just in the mood for some good beach time. Patrick White, good evening, family. One love. You got it, Patrick. We appreciate you, sir. Riley, once again from Florida. Stay safe. Thank you, Riley. Makiba Boland, good evening. Douglasville area, good friend and always on the show regularly. We really appreciate you. Carlos Ward from Douglasville as well. Thank you, Carlos. We appreciate you for participating. All right. Ernestine Murphy, listening from Hiram, Georgia. Okay, Ernestine, we appreciate you as well. Okay, North, East, West, South, California, New Jersey, New York. Hello, Alicia. How are you? Let's get to the questions, Howard. Okay, Trayvon Waters from Mansfield, Ohio. Okay, now we're getting the Midwest. Let's see what we got. Okay, Lance Kelly, type 2 diabetic, experiencing frequent urination. My A1C is 6.5. Had some blood work done for McKinney's and tested for an enlarged prostate. The test came back good. What do you think? Well, the problem is actually the type 2 diabetes. One of the key symptoms of diabetes is frequent urination. And that's because your kidneys do not tolerate the sugar well. And anything that you eat that has sugar causes a diuresis and makes you urinate. So A1C of 6.5 is good. That means you have decent control of that. But you also could have some prostate issues as well, depending upon your age. At age 40, 40% of men have prostate issues. At age 50, 50% of men. At age 60 is literally goes along with the decade of life that you're in. I saw a study that was released last week that was quoting that statistic. Dr. Collier's been saying that for 20 years. And so, sometimes people discover things that have already been discovered and they think it's new. So that's not new to Dr. Collier, at least. And those that have listened to me, we understand that prostate could be an issue. But the better control you have over the type 2 diabetes, the better improvement you should have in urinary function. And sometimes some of the medications that you take for blood pressure, as well as to control the diabetes, some of the newer diabetes medications, the SGLT2 inhibitors, such as Jardiance and Farxiga, they cause diuresis because what they do is that they make your urine filter out sugar, and so you urinate out the sugar, but that makes you urinate more frequently. And so that is one of the signs and symptoms, one, that the medicine is working, but two, one of the compromises that you have to make is that you're going to be urinating more frequently. One of the things that's not going to make any sense to you is that you need to drink more water. The more water you drink, the less concentrated your urine will be, and so you won't be urinating as much. I know that is antithetical. You say, wow, that doesn't make any sense. I'm drinking more water and I'm urinating less. But that is indeed what would happen if you did that. Thanks. Great question, Lance. Jamie Lee, are there any herbs or vitamins I can take for hidradenitis suppurativa? Okay, that is basically where you get abscesses in the axilla, under the arms right here, oftentimes caused by a couple of things you need to do. One, it is directly related to the type of deodorant that you're using and how you shave your underarms. If you take that razor and turn it upside down and come up like this, that's going to create a problem. You need to take that razor. What I say first is wash the area with a good antibacterial soap, such as Dial or Lever 2000, the two best antibacterial soap that exists. Make a good lather, then rinse off the dirt. Then make another good lather that's now clean. Put a shaving gel, not a cream, but a shaving gel, thick coats of the shaving gel. Take a good razor, not the razors that are $5 for $1 at the checkout stand. You need to get a good razor that has multiple blades, 3 to 5 blades, and that is going to cost you $15 maybe. And then when you shave one stroke down, rinse. One stroke down, rinse. You don't keep going over the area, and you do not turn that razor upside down. So that's good maintenance so that you don't get any microscopic cuts in the axilla area that would cause infection. And that's basically what hidradenitis is. It's infection in that area. There are new medications that you can take that will help with that. Traditionally, antibiotics are good as well. Sometimes if it abscesses, you have to literally cut it open and drain it. The treatment for an abscess is to open it and drain it. It may require packing as well. So it is a process. And if you are susceptible to recurrent lesions there, then you're going to be on a good maintenance program. And again, the main thing is the type of deodorant that you use that doesn't irritate you, and that you, when you shave your underarms, that you shave down. Black men and women shave down. We do not shave up. When you shave your chin, if you go like this, you're going to get razor bumps. You shave down, no problem. So that will be it. So, but no, the vitamins that I would take, because it's an inflammatory condition, omega-3 fish oil and vitamin D product will help decrease your body's immune response, which is also a part of this problem. So it's a broad spectrum disease state that many things come together to cause this to happen, and it can be irritating, aggravating, and it can, create an abscess the size of a small, as small as a plum, as big as a cantaloupe. I have removed them all. Sometimes you can just literally stick a scalpel blade in it, squeeze out all the infection, put packing in there, and just over time it will heal. So it kind of depends on what stage the lesion is at and whether they're recurring or not. If they're recurring too often, you literally have to remove what's like a balloon under the skin that's holding that abscess formation. You have to remove that, and so that it won't recur. All right, great question, Jamie Lee. Kevin Jackson, I use Lipo T 2 a day. I take a lot of medicine. I was expecting to change my sex drive because I've been lacking for no change. Could it be a result of so much medicine? Yes, some of the medications that you're taking could have a negative effect on your love life. Some of the disease states that you're taking the medication for, like blood pressure and diabetes, could also be having a negative effect. But the Lipo T will give you a boost, I promise you. You may need to increase the dose to 3 per day. And then it's not an instant thing. This is not like Viagra, Cialis, or Levitra. So it's not like you take it and 20 minutes later, you're good to go. This builds you up over time. But once you're built up, maintaining a constant state of sexual physical fitness. So you may need to take it for a few weeks, 4 to 6 weeks, before you really get that benefit. You may need to start out taking 3 a day and then go down to 2 a day for maintenance purposes. I know that I take 2 a day. Sometimes I'll even take 1, or I'll go every other day, because I got a high serum level of blood in my blood now. So it's not going to disappear after 1 or 2 days of missing a dose. So the Lipo T will give you that benefit. But again, it's also important, if you're taking a lot of medications, that 1, you're taking them appropriately. 2, that you are controlling the disease state in which you're taking them, which I would imagine would be at least high blood pressure, possibly diabetes, and possibly high cholesterol. And then make sure that some of the medication choices, particularly for high blood pressure, do not have a negative impact on your love life. So Lipo T does not fix the plumbing like Viagra, Cialis, and Levitra can do. It builds up testosterone and improves your libido. So it gives you the desire in an overwhelming manner sometimes. I mean, it really makes you ready to be ready. So that is the effect that it has. So have faith in it. Keep taking it, and you will get benefit. I want you to follow up with us next time for this broadcast and give us a report and let me know that after taking 3 a day, that you get that improvement. Okay, great question. Linda Tillman coming in from Augusta, Georgia. Hi, Linda. Thank you so much. Should I be concerned about cysts in my kidneys? Usually cysts are benign. They are benign renal cysts, which means there's no cancer. They're just the kidneys are a filter, and they're kind of like a balloon. And sometimes the filter can break down. Imagine, if you will, the screen doors that were in place in your grandmother's house back in the day. Before air conditioning, the only way to cool the house down was to open the doors and the windows. So the screens were there to prevent bugs from getting in and out, but allow wind to flow. Well, as long as the screen intact, no problem. But always some bad little kid would take a pencil and punch a hole in the screen. So now there are big holes that bugs can get through. Well, sometimes your kidneys are filters in just that manner. And sometimes just life in general, shaking, high blood pressure can do damage to the kidneys. And it's like punching holes in that screen and make bigger pores, so to speak. Those pores can become cystic, but they are benign and don't cause any problems. So you shouldn't have to be concerned about them. They'll probably do nothing for them, or just watch them, maybe doing recurrent ultrasounds over time. If they start to become too voluminous, you get multiple cysts or you get a big cyst that's taking up space in the kidney, then you might have to have it operated on or fixed in some way. There are various ways that can be addressed. But most of the time, the vast majority of the time, cysts in the kidneys are a benign thing. They're just usually a casual finding. You get a CT scan or MRI or even an ultrasound for something else, and then they find as a by the way, oh, we see cysts on the kidneys, and it's rarely a problem. Okay, great question, Linda. Amber Chambers, chronic fibromyalgia diagnosis this month. Okay, Amber, fibromyalgia is an inflammatory disease. It's defined by having signs and symptoms in joints and muscles. All the fibrous tissues, that can be tendons, that can be muscles, that can be the joints, the coverings of the joints, etc. It's above the waist and it's below the waist, and it's on one side of the body or both sides of the body, and it can migrate, which means sometimes it bothers you on your right side, other times it bothers you on the left side. So let me be clear, there is no fibromyalgia test that comes back positive or negative. Fibromyalgia is a diagnosis of exclusion, meaning we don't have any other reason for you to have all these symptoms, so we're going to call it fibromyalgia, which is really just an elegant description of what the symptoms are, that you're having problems in your fibrous tissues and your muscles. That's fibro and myalgia are your muscles. So that diagnosis is made routinely by what you tell the doctor is going on. And so based on that, what I just told you, that's the criteria, that it's above and below the waist, that it goes from one side of the body to the other side, it's migratory. And so which means it's not always in the same place at the same time, and it's a chronic condition. So the problem is inflammation. How do you treat inflammation? With anti-inflammatories. The two easy anti-inflammatories that we have are the vitamin D at 5,000 international units per day. The Doctor's D is readily available at the LipoDrop site. You can go right now. You see it, ticker tape. There are benefits and discounts available to people that tune in to this broadcast. And then omega-3 fish oil. Omega-3 fish oil is God's gift to inflammation of the joints and muscle tissues, because it kind of lubricates, oils, makes things easier, and it calms down the inflammation. So those two things, in addition to other natural anti-inflammatories. Our CMOS product is going to be very good for that. There's curcumin, there's turmeric that comes in capsules, powders, teas, gummies, you name it. It's available and out there. So a variety of those things. For prescription medication wise, there are a variety of different medications. There's a neuropathic blocker called Lyrica that gives great relief for fibromyalgia. And then anti-inflammatories such as Motrin or ibuprofen, naproxen, Celebrex, meloxicam, all of those can help. There's not one way to diagnose it. There's not one way to treat it. The treatment should be customized to what gives you relief. So you're going to have to be very good friends with your primary care provider or your rheumatologist now that you have this diagnosis, to optimize your treatment so that you get the best outcome that you can have. There is no cure for fibromyalgia. You can just control the symptoms. And it requires a lot of things, including making sure that you get the appropriate amount of rest, you decrease the amount of stress in your life, because all those things can be triggers that can make it flare up, if you will. All right, great question, Amber. Keep us informed as to how your progress is. I was born with phimosis. It's starting to be a burden as I get older. I'm also diabetic, so will the healing process be long? Am I making the right choice to cut? Gino, absolutely. Phimosis is when an uncircumcised man cannot retract his foreskin and reveal the head of the penis without, sometimes it literally gets trapped in there. And so that causes problems with infection, bacterial, staphylococcal, or yeast, or both. And it's that skin, when you try to retract it, the skin tears, breaks, and cuts down. It becomes it can just be minor irritation, or it can be overwhelming infection. So once you get to that point, there's no way to fix it other than to cut and remove the foreskin. That's called, the process is an adult circumcision. And as a diabetic, you will be worse not fixing it than you are fixing it. The healing process will probably be a little longer, but it won't be overwhelmingly so. The objective is to get your blood sugar as well controlled as you can before you have the surgical procedure. And it's an outpatient surgery. It takes literally 10 minutes. They're going to have to stretch the time out to make you appreciate how much they're going to charge you to do it. but your insurance company should cover it because it's a medically necessary procedure. And so make sure that you have a clear understanding with the urologist as to what your expectations are. It is not going to change the length or the size of your penis. There's mythology that if I get a circumcision as an adult, it's going to cut me in half or it's going to change. No, it's not going to do any of that. But what it will do is relieve you of this burden, so you won't have to worry about hygiene in that area. You won't have yeast. You won't be able to give your partner yeast. You'll have a penis that looks like most people's penises that have been circumcised, and so some people find that more cosmetically pleasing than an uncircumcised penis, but other people don't. So that's kind of how you feel about those sorts of things. But to answer your question, the right choice is definitely cut. The sooner the better to get that process, and the healing process shouldn't take. It'll be a week, no more than 2 probably, and that time will come and go. But right now you're suffering on a day-to-day basis, and probably it probably is unpleasant even when you urinate, and definitely is unpleasant if you try to have sex. And so we want to fix this problem as quickly as possible. So after that, get some lipo tea to boost your desire, and you'll be back in the saddle again in no time, Gino. Thank you so much. Great question. Catrella Smalls, my daughter has pustules on her scalp and hair loss due to it. She was placed on a string antibiotics and ketoconazole shampoo. What is this condition and how long will it last? Okay, the condition is tinea capitis. It starts off as a fungal infection of the scalp, but from scratching it and irritating it, you end up with a secondary bacterial infection. So she's being treated appropriately. She's being treated with antibiotics for the bacterial component and ketoconazole shampoo for the fungal component. She might even need to get oral antifungal tablets. Ketoconazole comes in tablets as well, and sometimes you have to take that to set up an antifungal barrier on the skin to stop that from growing. The shampoo is difficult to cure this condition. It will help control it, but to cure it, sometimes you need the antifungal pills, capsules, or tablets as well to do that. So the process is going to take a few weeks for the cure the fungus, clean up the bacterial infection. The hair should grow back unless she has scarring. If she has scarring, it's going to be a problem. So she can't scratch it. This is not the time to take a comb and scratch your hair, because you'll scar those hair follicles down and you will have permanent baldness there. But if the inflammation is taken care of and it heals, then the hair should return. This is a common problem. But if this is indicating that she is susceptible to a fungal infection of the scalp, she's going to have to be very conscientious about how often she washes her hair. And if you put your hair in the braids and put a weave on, this is going to be a problem. You're going to make sure you remove that hair. Good scalp health. There have been multiple documented cases of people that'll get hair, a weave, and leave it on their scalp for months and months and not really do a good job at maintenance. And then when they remove it, their scalp is infected. It's got fungus. It's got pustules. It's got all kind of issues with it. So this is going to require a good regimen to keep her scalp healthy. And it's going to start off with she's being treated appropriately with the antibiotics and the ketoconazole shampoo. But again, if that doesn't do it in a week or so, she's going to end up probably being on oral antifungals as well. So they're trying to clear up the bacterial infection first. And then if there's remaining fungus, then do that as well. So great. Your doctor's doing the right thing. It's just a matter now, tincture of time, and be patient. It's a process to get through it. It may be 6 weeks before everything is back to normal. So don't be surprised if that is indeed the case. This is not a take a pill for 3 or 4 days and everything is well. This is a process, but the outcome you're hoping for is good, healthy scalp and good, healthy hair. That's what you want. Otherwise, it's going to be a problem for a lifetime. Okay, great question. Carmen Davis. Good evening, Carmen. Thank you so much. Can you take Wegovy and nighttime lipo drops together? Yes, you can. Wegovy is in the class of drugs, the GLP-1 inhibitors. Wegovy blocks 2 receptors that do 2 things. 1, they take away your hunger, so you're not hungry. 2, they slow gastric emptying, which means whatever food you do eat stays in your stomach longer and you have a feeling of fullness. And so you literally can't eat. You cannot eat and you won't eat because you don't want to. And because your caloric intake becomes limited, you start to lose weight. And it is very, very good that this happens. It is amazing how effective this class of drug is for weight loss. The indication for Wegovy is diabetes, and people with diabetes lose weight taking this medication. They also get excellent control of their blood sugars. Blood sugars controlled, their hemoglobin A1C is controlled, and they lose weight. The package insert for the product says you may lose 8 to 12 pounds in a 1 year period. The reality of the matter is that you lose much more weight than that, usually up to 30 pounds for every 100 pounds that you are overweight. It is the equivalent to a gastric bypass without having to have surgery, without having to recover from surgery and have all the sequelae of having a gastric bypass. So this is absolutely incredible for that. The other medications that are like that are Ozempic and Mounjaro. Now, I need to correct something I just said. Ozempic and Mounjaro are for diabetes. Wegovy is strictly for weight loss if you're not diabetic. It is the exact same drug, semaglutide, as is the Ozempic. But the indication is for people that aren't diabetic, and you actually lose more weight if you aren't diabetic with the Wegovy than you would with the Ozempic if you are diabetic. This is a phenomenon that was just observed, and the study was just released over last week. I read it this weekend about long-term outcomes, because now the treatment of obesity with these medications is maturing. People have been on the medications now for over a year, and now the question is, how do you maintain the weight loss? And the question is, if you stop the medication, are you going to gain the weight back? If you start to resume your old eating habits, you will soon stretch your stomach back out, and you will be able to eat more, and you will gain weight back, because your thermostat is reset at a lower weight, but your baseline is wherever the weight was that you started before you lost the weight, and your body will try to force you to get back to that weight. It has nothing to do with your desire to lose weight. It has nothing to do with your stick-to-itiveness or your ability to focus or anything like that. There's a wicked hormone called ghrelin. I call it ghrelin, the gremlin. It tells you to eat. It makes you hungry. And because it's trying to get your body back to that preset point 40 pounds ago before you lost the weight. And the levels of ghrelin keep going up until you are literally forced to eat, just to get some resolution of that feeling that it gives you that you're always hungry. And so you eat and you eat and you eat. The problem is that even once you reach that set point that you started off at, it doesn't cut off for a while. And so most people will lose 20 or 30 pounds and gain back 30 or 40 pounds. And so they're worse off 6 months to a year later than if they had never lost the weight. So these new drugs, the GLP-1 inhibitors, are game changers. So the point being now that we're having such success with it, how do we maintain individuals once they've gotten to the weight that they want to stay at? So this is being developed in a creative way. Every doctor is trying different things to see how it works, and we are learning in real time. But to answer your question, the nighttime lipo drops together, you can also use the lipo drops max during the daytime. All those things will optimize, particularly your fat burn, because with the drugs, the GLP-1 inhibitors, you want to burn as much fat as possible. That gives you a sculpted look. So you're not just skinny, and you don't have a lot of loose skin, and you don't just appear frail. You will appear, your muscles will be outstanding, as if you've been working out when doing so. It gives you muscle definition, and you'll have a much more attractive, leaner body by combining those treatments. Great question, Carmen. But Kiva, if you take probiotics and antibiotics, do they affect each other? Yes, they do. Whenever I'm taking antibiotics, I always take probiotics, because the antibiotics are non-discriminatory. The antibiotics kill good bacteria and bad bacteria. And in your gut, you want the good bacteria. That is a necessary component to digest your food. That is why oftentimes when people take antibiotics, they will get diarrhea, because they're killing all the good bacteria that helps break the food down. And because the food isn't breaking down, you have large particles called colloids, and you have a colloidal effect that gives you not just loose stools, but sometimes explosive diarrhea. There are certain antibiotics that will do that 100% of the time. I know that Augmentin, which is amoxicillin and shavonic acid, is notorious for causing diarrhea. It is a very good antibiotic, but it will cause diarrhea. However, if you take the probiotics, you can minimize or prevent that from happening. But whenever I take any antibiotic, it can be of any antibiotic of any class, I add the probiotics to it so that my good bacteria in my gut is replaced. I do not take them at the same time. I will take the antibiotic, let it do what it's supposed to do, get through my stomach, get through my system, take the probiotic that comes kind of behind it so that it can replace the bacteria that's been eradicated by the antibiotic. So the probiotic, the good bacteria, antibiotics killing good and bad bacteria. And again, that will stabilize your gut and markedly improve, particularly if you're on antibiotics for more than 5 to 7 days. Sometimes for conditions like sinusitis, you have to be on antibiotics for 2 to 4 weeks. And it's a necessary because it's so difficult to cure those infections. So probiotics definitely, and our lipobiotic is perfect for that. I take one in the morning, one in the evening when taking antibiotics, and that helps tremendously with my recovery. Okay, great question, Bakiba. Rochelle, Abalon Shell. In continuing the conversation regarding vitamin D use this morning on Rickey Smiley Morning, why are Black women more prone to vitamin D deficiency? Probably because they don't spend a lot of time in the sun, and so their skin is not making vitamin D, and pigmented skin supposedly makes vitamin D better, but oftentimes, again, we're shy about sun exposure, so we don't get as much sun exposure. So that's one of the reasons that Black women, but guess what? You brought out a very good point that I failed to make this morning on the Rickey Smiley Morning Show, and I wanted to make it. I had it in my notes, and I forgot to mention it, that women respond better to vitamin D supplementation. They have better outcomes in their cancer therapies. They have better prevention of the cancers, better improvement in inflammation. All those benefits that you want from vitamin D are better in women at the same doses, 5,000 international units per day of a vitamin D3, which is the active vitamin D. Vitamin D2 is the inactive. Your body has to convert vitamin D2 into vitamin D3. And some people do that well. Some people kind of do it okay. And some people don't do it efficiently at all. So it's best to bypass all of that and just take a vitamin D3, which is the active product. And it's very good for you. But amazingly enough, one of the reasons, that maybe possibly the same reason that women are prone to vitamin D deficiencies is why they respond so well to vitamin D supplementation therapies, and that the benefits as far as cancers, again, bladder cancers, prostate cancer, breast cancer, all these things. And if you have a cancer diagnosis, one of the first things they do is place you on vitamin D, because vitamin D seems to help virtually any cancer therapy work better, because vitamin D inhibits the growth of the cancer cells. It makes them not live as long, so they die faster, and they die specifically as opposed to normal cells. So many different benefits to vitamin D. Very difficult to explain on the radio. This is one of those things where you need charts and pictures so I can really explain to everybody why this is such an amazing benefit and why Dr. Collier takes his vitamin D 5,000 international units every day on a daily basis. If you watch today, Rickey did a live. He came to my office and he did a live. He was literally picking up bottles, talking about what he takes on a daily basis. And I'm trying to get this in the screen right here. The vitamin D, there you go. Vitamin D, this is a doctor's D, 5,000 international units per day. And you see, it's got Dr. C on it. This is my personal bottle because I take it. If I forget to take it at home, I have it on my desk so that I can take it when I need it. Because I was coming down with a little cold or bronchitis or something, I actually was taking 10,000 international units per day for a couple of weeks. Now I'm back down to 1,000, to one caplet, which is 5,000 international units per day. But the Doctor's D, available right now as part of Dr. Collier's Healthy Trio, things that you need to take every day. Vitamin D, omega-3 fish oil, and probiotics. Those three things will be life-changing, regardless of whether you're male, female, black, white, large, skinny, regardless of your body type, regardless of your health status. You have high blood pressure, diabetes, high cholesterol. You have none of those things. You're just healthy. Either way, taking that combination is going to improve your health in so many different ways, make you feel better. You have more energy, help, maintain a good and healthy weight, all kinds of benefits. And again, Dr. Collier is not just telling you these things. I live it. I take these every day myself. I take those three things. I take the Lipo T for men's health, and I'm glad that I do. And again, my health is pretty amazing, I think, at this point in life. Okay, great question. Miss Audrey Ngalu from Africa. My 82-year-old mother may have to have hernia surgery. Can you talk about what a hernia is and how it develops? Is it safe for an elderly person? Surgery in itself, being elderly, puts you at risk, not from the surgery per se, but from the anesthesia. And then putting you to sleep, anybody can do. Waking you up is where the magic comes in. So we want to make sure that the anesthesiologist has experience with an elderly patient, an elderly person that has comorbid conditions like high blood pressure, diabetes, etc. I know that a hernia is a defect in the muscle. There can be hernias for men. The most common area is the upper groin, left or right side. Those are called inguinal hernias. They can either bulge out on your just above your pubic triangle, or they can literally bulge into your testicle to make your testicles swell up like a basketball. Or everybody's familiar with an umbilical hernia. That's where the muscular wall of the abdomen has a hole in it where your belly button is, and then when it bulges out, that is literally a loop of intestines that is going in and out. As long as it goes in and out, it's not a problem. If that loop of intestine gets trapped, then you have what's called an incarcerated hernia. That is a medical emergency because that loop of intestine is not getting appropriate blood flow, so that tissue starts to die. It hurts like crazy initially, but after a while, once the tissue is dead, it stops hurting. So a lot of people, if they put their nose to the ground wheel and get through it, they think they are better, but now they are in a medical emergency and literally are in danger of getting septic and possibly dying, having a ruptured intestines, which can cause sepsis, or they can just acutely die. And this can happen in a matter of hours. And the thing is that you're actually feeling better, whereas earlier you were doubled over from the pain being so severe. So it's very important that you casually repair a hernia versus on an emergency or an urgent basis. Now, the next would be a hiatal hernia. A hiatal hernia is where the esophagus, which comes through the low pressure area of the chest, the thorax, where your lungs are, that area has little or no pressure, almost negative pressure, so that as you breathe in and out, there's no resistance and breathing is not work for you. Immediately below the diaphragm, which is the abdominal muscle that makes your lungs go, it bulges up like this. It makes you breathe back and forth. That hole where your esophagus come through to get into your stomach, which is below the diaphragm, is called the hiatus. If that stretches out, or if part of your stomach goes up into your chest wall, that is called a hiatal hernia. That causes everything from acid reflux to chest pain. You think you may be having a heart attack, and the problem is that you have stomach that should be below the diaphragm, above the diaphragm, is causing that problem. So a hernia can be any or all of those things. So it depends on which one your mother's been diagnosed with. But the answer to the question is surgery. The hiatal hernia used to really be difficult to repair because it required cutting into the stomach and the chest. And so even if a person survived that, you were never the same. You always not quite up to par. You lucky if you could come back to 80% of who you were before. Nowadays, they can do this laparoscopically. They can go through your belly button with a scope, repair it in literally 10, 15 minutes, and the recovery time is minimal. So if that is indeed the case, then that's what's called minimally invasive surgery. Very easy to do, and one that should be offered to your mother to make sure that her recovery is not so difficult. All right, great question, Ms. Audrey. Yakita James, I believe my husband has EPI. He is diabetic, has all his stools and abdominal pain daily. He lost a lot of weight, 300 pounds down to 135 in about 2 years without trying. It's not just diabetes. Okay, one, something is going on that is a ridiculous amount of weight loss. His diabetes may or may not be controlled. He probably does have EPI. That is where you're having difficulty with bile digesting your food, and that's why the stools are oily, because bile, which is stored in your gallbladder, when you eat something fatty, a signal via neurohormonal system tells your stomach there's fat in the stomach. Your gallbladder squeezes. It's kind of like a perfume atomizer. You squeeze it, it squirts bile. That bile is highly acidic, and it dissolves that fat. Well, if you're not getting that fat dissolved, it just goes through your intestines until it gets to your colon, and now so your stools are oily, loose, and difficult to pass, and very foul. So he needs a complete workup to imagine. It could be something like an infection in the colon that's chronic now, and he's having difficulty digesting his food. It can be gallbladder disease. It can be liver disease. This is going to require a very thorough workup by a gastroenterologist, stomach specialist, who can evaluate this is what's going on and see if this can be corrected. Because that kind of dramatic weight loss. Now, he's skin and bones at 135 pounds for a grown man. So this is urgent, if not emergent. So we need to get him into a gastroenterologist for a full and complete evaluation to see what's going on with that. Yakita, I'm so glad you reached out. Your husband, EPI is a great diagnosis, but don't go into this with a pre-diagnosis in your mind. The problem is that he's got unexplained weight loss and not trying to lose weight. He's got the abdominal pain and loose all his stools. Those signs and symptoms are consistent with several other disease processes as well. So if you go in thinking it's EPI, just go in, present the symptomatology, and let the doctor do diagnostic tests to come to a conclusion for a real diagnosis. But I agree with you. It does sound like that. But again, there may be some rest of the story that I'm not aware of that may alter my diagnosis of that. But the bottom line is it doesn't matter what the reason is. We cannot have him down to 300 pounds, down from 300 pounds to 135 pounds. That he's lost muscle, he's lost fat. Diabetes may have been what triggered it. His diabetes may be totally out of control, and that would cause this. Give you numbers incompatible with life, but yet you live. God has a plan for him, and he's just still around because his plan has not been fulfilled. So this is something right now where an intervention is probable. It may even require hospitalization to get all the testing that he needs. But this is, like I said, definitely urgent, if not emergent. So Yakita, take care of that man in your life. Give me an update as to how he's done next time we do a live broadcast. Okay, great question. Just being I'm not sure how that is. 33, dealing with obesity, type 2 diabetes, non-insulin dependent. Okay, PCOS, polycystic ovary syndrome, and anemia. What is the root cause and how to solve it? I'm searching for ways to lose weight without surgery or medicine. Well, you can always lose weight by eating less and exercising more. One that hasn't worked for you and probably not going to, because with obesity, there's other metabolic problems that you can't address just by saying, okay, I'm going to eat less and exercise more. It's a complicated situation. Sounds like you have metabolic syndrome. And so each of those disease states needs to be addressed. This is not going to be an overnight fix. You need to partner with a provider that is sensitive to each and every one of these disease states. If you have type 2 diabetes, you would be eligible for one of the injectables, which would probably be excellent for you. That would be the Mounjaro or the Ozempic. I think the Mounjaro is a better molecule. They both work, however, and I would go with whichever one your insurance company would cover. There are also other treatments, the SGLT2 inhibitors, that will be Jardiance and Farxiga, which also have been shown to have benefits for the heart and the kidneys as well, so cardiovascular benefits. So they're using these medications in people that don't have diabetes. They're using them in people that have heart disease and kidney disease, and they're getting great benefit even though they're not diabetic. So the problem is one of inflammation. You need to take with obesity as well. I would take probiotics. I would take Lipo Cleanse. I would take omega-3 fish oil. I would take vitamin D. All of those supplements will help whatever your prescription medications are to treat these disease states. At 33, you got a lot of life ahead of you, and we want to get you to be as healthy as you can be. And so polycystic ovary syndrome is directly related to being obese. So being overweight, but it also can cause obesity. And also hirsutism, which means you have hair growth in women, mustache and beards, that can be a cosmetic problem. So with a diagnosis of type 2 diabetes and polycystic ovary syndrome, you are eligible for these medications. And so no matter what the type of insurance coverage you have, you ought to be able to get those treated. And if your doctor is not aware that these are treatment options, then you need to share that with them, or go to even an endocrinologist who definitely would be and could help with that. So just being Lachey. Oh, I got it now. Just being Lachey. So just being Lachey, keep being Lachey, and let's get yourself healthy. But those are the things that can help, that you can do for yourself. You can start taking supplements now that can help with the weight loss. Anything that you do to lose weight loss. The Lipo Drops Max, the Lipo Nights would help. Again, the Lipo Cleanse, the probiotics, virtually everything in our armamentarium would help you with the weight loss. And because you're tuning in now, there are a lot of good discounts available for you. As you see scrolling across the bottom of the screen, go to the lipodrops.com website, and there will be some information there that will direct you as to what of the products would be best for you depending upon what your objectives are and what you're trying to accomplish. But because you have those diagnoses of obesity, type 2 diabetes, and polycystic ovary syndrome, you'll be eligible for some of these miracle medications that are now causing dramatic and outstanding weight loss in patients. Okay, great question. Okay, Carlos Ward. Sometimes I experience pain in my right shoulder at night while sleeping. If I wake up and sit up in bed, the pain seems to go away. Any thoughts? Carlos, you're a perfect patient. I tell people all the time, they say, Dr. Collier, it hurts when I do that. So Dr. Collier says, guess what? Don't do that, whatever that is. So if you find that laying down on your right shoulder is causing you pains and problems, and oftentimes this is indeed the case. We are so used to sleeping in a certain way. We grew up that way. But as we age, the nerves and the vasculature, the arteries and the veins that go to particularly joints like the shoulders cannot support your body weight. And so you get uncomfortable. And so it starts to become unpleasant. Your body is telling you to move. And what you do, you shift to the other side. So now you're trying to seek comfort. You're not sleeping. You become chronically sleep deprived and hangry. So you're hungry, you're angry, you're agitated, you're irritated, all because you're not getting a good night's sleep. So you're going to have to change your sleep posture. So you don't have to sit up, but it's just that when you do sit up, that takes the pressure off your shoulder. My recommendation is that you sleep on your back. If you don't have an adjustable bed will be perfect for you. Or you get 3 pillows. You put one under your middle of your back or your thoracic spine, 2 under your head and neck, so that your body is propped up at about a 15 to 30 degree angle. So instead of laying flat, you're propped up like this. That way, your neck and your shoulders can relax, and you will get, you won't have that problem with your shoulder hurting. But this is strictly an ergonomic phenomenon. And it sounds like you just need to change that. So you won't be able to sleep on your side. You won't be able to sleep on your stomach, because on your stomach, you have to turn your head one way or the other. We call that the swimmer's position. So you're either like this or like that, or you got your arm folded under your neck, and that causes problems with your neck and your shoulders, and you'll be not able to sleep well, or won't feel rested even if you do sleep. Sometimes after missing so much sleep, you're so exhausted that your body will go to sleep. But boy, when you wake up the next morning, because of that sleep posture, you're so stiff, you're so sore, you're so uncomfortable, that then you can start setting up things like arthritis. So changing that sleep posture, which is very difficult to do. It's not going to happen overnight. And even now, Dr. Collier has a same or similar story, and I have to fight it every night. I go to bed. I got the adjustable bed now. I let my bed up about 15 to 30 degrees. I lay there. I try to get comfortable, making sure that when you have the cover and the blanket on your feet, your toes are now pointing like this. This shortens your calves and can cause cramps at night, muscle spasm. So what I do, I put on footies, socks, uncover my feet so that my toes are free. They're not covered under the cover at all, but everything else is, so you're still warm. But that prevents that from happening. You can lay flat on your back, and this is something, again, that's going to require a change in the culture of how you're sleeping. So it's not going to happen overnight. But Carlos, I promise you, you change that sleep posture, you're going to get a better night's sleep, and that shoulder will not be bothering you anymore. All right, great question. Godfrey Bofa. Dr. MJ, I hope you're well. Please, my son is having these rashes on his leg, but we don't know what is causing them. Please, can you help us? Okay, Godfrey. I think I saw those pictures earlier. Highlight was able to get them to me from the website. Those pictures look consistent with a contact dermatitis or eczema. And so the traditional therapy for that is one, it's a complicated thing. One, you have to moisturize that skin. So I recommend moisturizing with a lotion product that has vitamin D, which is very good for skin health. I use the Suave brand, Suave, which is over the counter, large bottle, is $4 or $5, and you can use that to moisturize the skin. 2, you need to use an antibacterial soap on the skin. There are 2 options. Lever 2000, the traditional, comes in a silver box with a green stripe, or Dial soap, the white bar, the gold, not the gold dial that floats, the white bar of Dial that won't cause itching. Okay, so you've cleaned up bacteria, which causes infection, and now you have moisturized the skin. but you're going to have to put some anti-inflammatory steroids on there. You can start off with over-the-counter hydrocortisone, 1%. You can get this at the store where everything used to be $1, now it's $1.25. It'll say anti-itch cream or hydrocortisone cream, 0.1% as early treatment options. This is a chronic condition. If you're susceptible to eczema, then it's going to come and go. You can be allergic to your own sweat if you get dirty skin, if you get sweaty skin. Certain fabrics and things that you come in contact with can cause a problem as well. So it's going to require a routine maintenance program to keep this under control, but there will be times when it flares up. There are actually biologics now that you may have seen advertised on television. They are injectables and pills that a patient can take that are also good for eczema. That is later stage or recalcitrant or not responding to other therapies. But the most common things are simple steroid creams and a treatment regimen that includes an antibacterial soap and a good moisturizing lotion to keep that skin from getting dry and cracked. Because the child will scratch, the scratches get infected and it flares up. But from those pictures, and it looks like there was arm involvement, leg involvement, etc. That's what makes me think it's a contact dermatitis as well. And sometimes a contact dermatitis can have a secondary infection, usually caused by staphylococcus, which is on everybody's skin, and that may require some antibiotic therapy as well. So it's going to require someone to do an evaluation hands-on of this. It's not a complicated disease state, but it is one that's going to require, you can treat it, clear it up, and 2 weeks later it's right back again because you are susceptible to it. And this is strong in my family. 3 of my kids have it, 2 of them don't. It's amazing that they have that. All of them have grown out of it now. But I tell you, my daughter would be so reactive. She could put on a belt, and the belt would make her break out around her waist. She could put on jewelry on a watch or earrings on the ears, and the skin would break out there. Her hair would make it break out on her neck and her back. So all kinds of issues. And now she seems to have minimal problems with the eczema. But I tell her it's a lifetime curse. It can come back at any time. And that's just something you have to stay on top of. My son, as a baby, an infant, would have a pacifier that was supposedly hypoallergenic, which means it doesn't cause reactions. And around his mouth, he had the perfect outline of the shape of that pacifier breaking his face out. So it was amazing how we discovered that in him. So again, it's a problem. Can be just a chronic condition that causes irritation, bothersome aggravation, but it can become more serious if it gets infected and goes from being a contact dermatitis to an infectious dermatitis or impetigo, which can literally infect a patient or a child from head to toe in a matter of hours. I've seen it march, as they call it. You scratch one open area and it's all of a sudden all the skin over your entire body is susceptible. It's like the pores open up and let the bacteria in, and you can literally watch over an hour period of time the rash go from the feet, the lower legs, the upper legs, the trunk, the upper body, the head, the neck, everywhere. So this can be a problem. So remember what I told you. Antibacterial soap, Libra 2000 or Dial the White Bar, moisturizing lotion such as Suave with vitamin D. There are other lotions that you can get like Lubriderm, Corel. Those are very expensive in comparison. I think you get the same benefit with the Suave brand with the vitamin D at much less price. And then the steroid cream, 1% hydrocortisone cream, which costs you $30 or $40 in some of the other pharmacies. But at the store where everything is $1, it's $1.25 now. And I just buy them by the case full. I keep it around my office. I give it to patients. I just hand it to them when they come in with rashes. I just give it to them. And I keep it at home because somebody's always got an itchy rash or an outbreak of the eczema and they need treatment. All right, great question. Let me get another sip of water here. Okay, Shakidra Collier. Hey, hopefully we're related. I have muscle spasms in my upper back. What can I do to help not to get knots in my back? I don't want to be on pain medication because too many Black people get addicted to pain medication. Well, muscle spasms can cause pain. It's a vicious cycle. You get spasms, you get pain, you get spasms. So it goes into a circle and it's continuing. So you have to relieve the inflammation, which is usually one of the causes of the pain. and use a muscle relaxant to help relax the muscles. And then sometimes it does require a higher level pain medication, but most of the time it does not. Most of the time, ibuprofen, 600 or 800 milligrams 3 times per day, or naproxen sodium, 500 milligrams 3 times per day, along with a muscle relaxant. There are several that are sedating, like Flexeril, that are non-sedating, like methocarbamol and baclofen, that can help relieve the muscles. It might be something as simple as doing range of motion exercises and stretching those muscles out and getting to know your friendly chiropractor or massage therapist. All of those are natural treatments that can give you great benefit. You got to be conscientious about your posture. If you work at a desk and you're constantly leaning over to look into a monitor, like a computer monitor, or you leaning over like this, or you walk around with your cell phone doing social media out there with your head like this, that can cause that. And that's really going to be a problem for this generation, because 100% of people do this. I'm going to restaurants, I see people walking around, I go to movies, everybody's holding their phone and holding their head down. That is the absolute worst posture that you can be in, and that's straining those muscles in your neck and back and causing probably some of these spasms that you're having. But massage therapy, physical therapy, chiropractic therapy may give you all the relief that you need. If not, anti-inflammatories and muscle relaxants will be the first choices, and those are prescription medications. You would have to get them from your primary care provider, but again, easily obtainable and not addicting, not sedating. You should not have any problems with that. And if your pain was so severe that you needed a higher level of pain, there's no honor in hurting. Pain medications, when taken appropriately, are perfectly fine therapy. It's when people aren't hurting and they're taking pain pills to get high or happy, that's when they get addicted to them. But if the pain medication is actually relieving you pain, addiction is a rare outcome from that. Okay, great question, Shakidra. Okay, Joy. Would I see results differently when taking vitamin D, omega-3, and probiotics since I have IBS-C? Yes, but probiotics are going to give you the best benefit, but the vitamin D and omega-3 will calm down the inflammation, which is irritable bowel syndrome as well. Now, there are actually prescription medications now that are in the class of drugs called biologics that are showing amazing results with irritable bowel syndrome. But the simple things, or what you just mentioned, the vitamin D, omega-3 fish oil, and probiotics may give you all the relief that you need, and they're natural. The biologics are amazing, but they are for people that have a resistant disease, or just, the irritable bowel giving you explosive diarrhea. You can't go anywhere, you can't function, you can't eat, you can't do anything. So that, because those medications do mute your immune system, and you make you susceptible to other types of infections. But sometimes they are necessary to relieve the symptoms of the IBS. But the natural things that you just mentioned, the vitamin D, the omega-3 fish oil, and the probiotics, literally may give you all the relief that you need. Again, it's not going to be a take a pill today and you're cured tomorrow, and it will be a chronic therapy. You will need to stay on these products to control those symptoms. But after you've been on them, every day will be better than the previous day. And after you've been on them for a couple of weeks, you should notice marked improvement in all of those symptoms. So each one of those are well within our preview on the Lipo Drops product line. The vitamin D at 5,000 international units per day. The omega-3 fish oil taking 2 up to 4 capsules per day, depending upon your symptomatology and your size and your weight. If that picture that you have there is consistent, then two a day ought to be good enough for you. And then the probiotics 2 a day as well. Okay, great question. We're going to close it up right now with Veronica's question. She's going to be the last question of the evening. What are the side effects of diclofenac 75 milligrams? Diclofenac is a non-steroidal anti-inflammatory drug that's in the class of medications like Motrin, like ibuprofen, like naproxen sodium or naproxen, like Aleve, like Advil. The great benefit about diclofenac is you only have to take it twice a day. Those other medications that I mentioned are optimal at 3 times per day. Some people only take them 2 times per day, but they work better at 3 times per day. And the diclofenac is only twice a day. Also, certain types of diclofenac tablets are coated so that they do not dissolve in the stomach. They do not dissolve until they're out of the stomach into the pH of the upper lower intestines, which means they don't irritate the stomach. All anti-inflammatories can irritate the lining of the stomach and cause gastritis, which is inflammation of the stomach, or even peptic ulcer disease, or cause stomach ulcers. But diclofenac was specifically formulated to avoid that or decrease the chances of that happening, because it's not metabolized in the stomach. It goes through the stomach. And so it should not irritate the lining of the stomach until it gets into the small intestine. But it is a very effective 2 times per day. I like it particularly for disease states like gout and rheumatoid arthritis, but it is a good anti-inflammatory that can help with any type of pain and inflammation, from back pain to headaches. So great choice of product. They also have it now as a topical gel called Voltaren, and you can get it over the counter that you can literally rub on if it's joint pain that you're having or inflammation there. So it doesn't go through the intestines at all. You can get the benefit of it from just rubbing on it. The problem is you have to rub it on 3-4 times per day, and that can become a problem. And then you also go through it. When you get a prescription, you get 5 tubes, which could last you a month, provided you're not having to use it on multiple joints. But it also can be used in conjunction with the oral diclofenac as well. So that's our final question this evening. Thank you so much for joining us this evening. We are live in the studios at the Ask Dr. MJ Facebook Live, Instagram Live, YouTube Live, and live on the Lipo Drops website. Thank you for participating. We'll see you next time. Go to that website, lipodrops.com right now. Take advantage of all the things and watch. Stay on top. When you see the sea moss, the immunity mushroom, the women's lipo chic coming out, the libido booster, don't miss it. And we're going to have great sales coming up for the upcoming Thanksgiving and Christmas holidays. Thank you so much, and we'll see you next time.